So one thing that is missing in my bag is an aero chamber, and basically an aero chamber is for administration of asthma medication. So I don't have one, but I will be putting one. So basically, it's kind of a little tube. It looks a little bit like a bottle of water, uh, like those little bottle of water that you drink, and basically people can put their medication and drink out of it. So that's the other things. Um so the other kit. What's this kit? So basically now this kit, if you have somebody, another thing that you could probably help someone, and that's pretty much the only one that I'm really thinking about, is that if they would have heart failures and in kind of stress or not with their proper medication and things like that, it could get worse. So for those patients, there's maybe something we could do, and it's based on a study that they did, um, showing that sauna can have an improvement of CHF patients, CHF for cardiac heart failure patient. But there's another thing that we do in hospitals that can help. And you can kind of improvise what we do. Obviously, it is MacGyver-ish duct tape. Again, it is not 100% sure it will work, but between not doing anything and at least giving a chance with that, there is a chance. So I'll explain a little bit the setup and how it would work, and actually show you a little bit how it would work. So basically, what it's called CPAP or BiPAP. So CPAP is for continuous positive pressure, and CPAP is continuous, and BiPAP is for two pressure, and it's a little bit complicated concept. But one is continuously, the other one depends on if you're breathing in or breathing out. So what does that have to do? So basically, when you're alveoli, so when you have cardiac heart failures, is basically imagine that you have little alveoli, so it looks like a little ball. It's full of water, and oxygen needs to transfer from your alveoli, from your capillary through your alveoli into your lungs on both directions. So the CO2 has to come out, the oxygen has to come in. The CO2, just like when you have a glass of Coke, can kind of get out pretty easily. The bubbles that you see. So it can get out pretty easily in liquid, but oxygen, it's not that easy. It needs a little bit of pressure. So more thickness that you have between, that is mucus, water, whatever, that you have between your capillary, which is where your oxygen needs to go, and the oxygen that comes in, it's harder for it to do the transfer. So what we do is in hospital is that we put them on a mask, or even pre-hospital, and I have that possibility, is first we bumped up their oxygen, which is pretty hard in a self-reliance situation. But if you have anyone with heart history, and I mentioned that in the past, and I'll put a link, there's a thing that you can buy. So if you have someone with COPD or any heart problems or anything like that, and basically it's an oxygen concentrator, and what it does is that it gives about 4 liters of oxygen. So all it does is it takes the oxygen. It doesn't need an oxygen tank. It just runs a little bit like on a generator. It's like a generator a little bit, so you could run it on a generator too. It takes the oxygen outside and out, concentrate it, and gives a certain percentage of oxygen, so you could increase their concentration of oxygen. And there's portable ones for when you travel as well. So if you would put that on someone, you would increase their oxygen. So that would be the first thing that could help them with that. The second thing, that thickness of water, there's a way you can push by pressure. And this is what we're going to create. We're going to create some positive pressure with a mask. And we're doing that in a certain hospital, obviously with more advanced stuff and more trained people. Again, this is a MacGyver duct tape kind of situation, but it can work. And I'll show you. So the kit that I carry over here is basically a poncho, the cheap dollar poncho, and a emergency blanket. So an emergency blanket and a poncho. And this is for the sauna part. And so the sauna part, basically what you're going to create is that you're going to create a vasodilatation. So when you're in a sauna, that's why you sweat. So if I have, when I have my pressure cooker. That means I can create some steam. So that means you could kind of create a sauna. So basically, if I put the poncho in this, now I'm creating a sauna and I'm creating a vasodilatation. Obviously, you have to be careful with those patients or those people, because too much vasodilatation, that means they can pass away because there's not enough functioning and stuff. But I'll put the link to the study and you can make your own judgment on that. But basically that's the approach, and that's why I carry this. The second part, we'll come back on that one. So I'll explain the system and then I'll do a demonstration, or else you won't be able to hear me with the mask. So basically it's two straps, and those straps basically hold the mask as tight as you can so there's no air leaks. The mask, and this is again from this the bag mask, is hold onto your nose. The PEEP valve pressure, what it creates is some pressure in your lungs when you breathe, and the bag is just to help you push that air in. And so when you breathe in and out, it creates a positive pressure, which, like I was saying, it kind of decreases the pressure of water. So basically decrease the size of that water thickening that happens in the alveoli and help with the oxygenation. In hospital settings, when we do that, a lot of those people turn around, especially when we start giving medication like nitroglycerins and things like that. It turns around and we can prevent them from having a tube. So if you ever have someone in a crisis like this, you don't have nitro, then you can use that sauna concept, which would kind of help with the vasodilatation, and this would could help with the oxygenation. Maybe, and again, big maybe, you could turn around the person and help them with that. And with people now with a lot of problem with like COPD and heart problems and things like that, it's kind of a situation that it could happen. It's a big maybe, but it could work. It sounds it's based on things that we kind of do. Try it on me. I can kind of feel the pressure. So it seems to be a possibility in functioning. Again, I don't take any responsibility for doing this, and it's more like for sharing and anything like that. So let's show how it works, and we'll come back for the conclusion. So I know you cannot hear me properly, so I'll do a demonstration and I'll explain a little bit how it works. Okay, so now you saw how it works. So basically, create kind of pressure on the lungs, and it pushed that water out. So this is what my airway bag kind of looks like. It has a little bit of multi-purpose. It's very limited in what it carries because I don't want to. Again, there's limitation of what you can do in certain people. Like if you want to do CPR, there is some case that you would do just like in the outdoors. People, if they're caught in an avalanche or if they're hit by lightning, you can bring them back. But if they have a heart attack right in the middle and there's no other resource, there's not much that chance that you're going to bring them back with CPR. So that was my bag. Hopefully that was helpful. And again, be careful about doing those things. It's not a course. I'm pushing you to do your own research, do your homework, go and learn, and we'll talk to you soon.